Chronic diarrhea is diarrhea that lasts for 6 weeks or more. And that definition comes about because it's fairly common that patients may have an upset stomach, perhaps an episode of food poisoning, or just eating something that doesn't agree with them. That's fairly short-lived and lasts a few days or perhaps a week or two at the most. So if diarrhea lasts for 6 weeks or more, then the list of possible diagnoses changes and may then include chronic or long-standing conditions such as ulcerative colitis, Crohn's disease, microscopic colitis, or indeed irritable bowel syndrome that is diarrhea predominant would often fall in that category. Chronic diarrhea, if it's progressive, so in other words, once it starts, it tends to get slowly worse over time, is often a sign that there could be a serious underlying condition. Also, if it persists during the night, so if patients have to get up at nighttime to have a bowel movement, then that often indicates something more serious. And also if it's associated with other symptoms such as loss of appetite, loss of weight, or associated with abdominal pain, and those would be the indicators that it needs prompt assessment. Again, the bottom line is if you're concerned, I think I would tend to keep it general. So there's no strict timeline that you have to wait a certain time before you see a doctor or a specialist. But certainly if diarrhea is lasting for 4 to 6 weeks, you should see a specialist to start down that diagnostic pathway. It very much depends on the underlying cause. So if it's diarrhea predominant IBS, then often it's diet, lifestyle, looking at the patient's current medications to see could this be a side effect of a medication they're on for another condition. And then simple antidiarrheals such as loperamide may be helpful for patients. And often it's a combination of all of those factors to try to treat symptoms. If it's due to ulcerative colitis or Crohn's disease, then treatment is directed at anti-inflammatories or anti-immune type drugs to try and damp down the immune system that's overactive. And there's a whole variety of treatments that will be worked through to try to get the condition under control. So if the chronic diarrhea is due to irritable bowel syndrome, then often diet changes can help. Keeping a food diary for a period of 4 to 6 weeks can be enlightening because it can allow patients to identify particular triggers that may be exacerbating their symptoms. But things such as coffee, caffeine, chocolate, chewing gum, citrus fruits, acidic fruits, and then after that, any potential additive in especially processed foods could be contributory. So I usually advise patients to look critically at their food intake and drink intake to see if we can identify triggers. And often by the time patients come to me, they have a few potential things that they have identified and may have cut out or cut down to try to start that process. And it's a case of working through it further. And then if necessary, a referral to a dietitian may be helpful if they have ongoing symptoms.